So I uploaded a video yesterday and I talked about a few things. I uploaded it in the membership area. And this is one of the things that I talked about that I want to talk about here. Because if we don't put a stop to this now, if we don't put pressure on these hospitals right now, we're going to find ourselves a little older and having to be inside of a hospital ourselves. And while we are there, these people are going to force dogs onto us. Right? We're going to be laid up in the hospital without having a chance to talk. We're just going to wake up in the hospital. And we may wake up to a worthless mutt. A worthless mutt, service mutt. Right? Now listen to this.
We at the Stevenson Cancer Center are committed to reducing the spread of COVID-19 within our communities. With weakened immune systems, cancer patients need to take extra precautions. Wash your hands. 20 seconds is all it takes. Sneeze into your elbow or tissue and avoid touching your face. Avoid all non-essential travel and stay at home as much as possible. Avoid social gatherings and keep a distance of at least 6 feet with other people. Stop shaking hands. It's not rude, simply necessary.
You hear that? For cancer patients, they have the same protocol as the COVID protocol. Social distancing, don't shake hands, avoid large crowds. This is advice for cancer patients. How crazy is that? Now, you can find articles and information everywhere. This is from the American Cancer Society. Why people with cancer are more likely to get infections. This trend of bringing service dogs into hospitals for cancer patients goes directly against their own information, their own advice. It goes against the advice of the experts themselves. We can't allow them to get away with this. No, we have to at least hold them up to the standard that they themselves have set. See, they're trying to just ignore all of this. No, I don't think so. People with cancer, look, according to this article, might be more likely to get infections because of the cancer itself, the cancer treatments. Both the cancer and the cancer treatments alter your immune system and increase your chances of infection. Didn't I just talk about how these mutts release so much dander on a constant basis that they contaminate the air itself with fecal matter? That's exactly why they would wipe the dogs down every 10 minutes. Every 10 minutes. This was after washing the dog. Why? Because they're trying to sterilize the dog's dander. Do not trust that, because even they have admitted that they do not, quite often, they do not follow the health protocols of wiping the dog down or washing it before it arrives. They've admitted to that. This is totally unacceptable. These people are out of their flipping minds. Poor nutrition, other problems or medication. Look, cancer itself can increase infection risk. Now, I shared this article a couple years ago, a year or so ago, how those therapy dogs can spread superbugs, this staph infection, to kids who are in the hospital. They did an entire study and they found that these therapy dogs were infected with this superbug. And you keep in mind, they were only checking for the superbug. That mutt may have had all types of bacteria and parasites and stuff going on. It's hard to totally deworm a mutt. You want to bring them in the hospital so these people can hug and let these things lick on them? Parasitic eggs end up on the dog's fur itself. And if these people are bringing dogs in there, you know for a fact, even according to this study, those patients now have more traces of the superbug than they had before the dog arrived. They actually found this in the study. And this is, you're telling me that this is something that's about to come more and more common? Here it is right here. Kids who spent more times with the dogs had a 6 times greater chance of coming away with the superbug bacteria. They're telling you right there, these things are nasty. And you need to keep them out of hospitals. Hospitals are not animal shelters. They're trying to treat hospitals like animal shelters. Look at this. Clean therapy dogs can spread germs. Okay? Germs. And here they mention again that staph infection and how likely dogs are to spread this staph infection. But they're only talking about this one staph infection. These people are too ignorant about germs and bacteria in general, as new ones emerge all the time, infections and all kind of stuff. This is just unacceptable. Therapy dogs visiting hospitals and nursing homes may be able to transmit diseases to people, even if the animals themselves are germ-free, according to this article. Even if they're germ-free, they've noticed that these mutts pass diseases. Now, this is unacceptable. You dog nut cancer patients who want to hug and rub on a mutt, they should all have their section in the hospital, and when they want to rub on a mutt, transport you to an animal shelter. You go inside of an animal shelter if you want to do all that. No, that's just the risk. These people should not have the right to enforce dogs onto everybody, because see, people who don't want dogs there, they are less likely to speak out against the dogs, because many of these nurses are dog nuts. They might withhold treatment or anything. You got a dog nut nurse or doctor who knows you don't like dogs and don't want them around. That's not the type of hospital you want to be inside of. Now, this article was pro-mutt. They support the idea of therapy dogs in hospitals. They wanted to make an article. And all they did was refer back to the same article I showed a year or so ago. That if you wash them and pat them down every 10 minutes, everything will be okay. Which is a lie. Because as you can see, even the writer of this article admitted that when you wash them and use sanitation wipes every 10 minutes, all it does, this is according to a doctor, all it does is decrease the bacterial levels. It doesn't eliminate them. You cannot totally eliminate mutt bacteria. So this infuriated me. I included the contact information. I contacted them through every means. Okay, and I'm going to leave the contact information in the description box. I haven't left the Google review yet, but I will. But I called and left a message on their website because it's more likely that I'm going to get a response, which I have not yet. Right? So I'm going to leave this information because I believe that these people, they need to be called out. Every time they want to implement some type of program like this, where dogs come into hospitals around cancer patients, every time they try to do this, They should have an influx of calls, emails, and negative Google reviews. They should deal with a lot of pressure, because if they don't, they're just going to continue to do this until every single hospital in this country is full of mutts. They're trying to turn hospitals into that nasty home I showed in a recent live stream. Let's not allow this to happen without a fight as we continue with this crusade against these worthless, nasty mutants and their enabling owners.